back mga kada. Ito seryoso usapan ito. Ang breast cancer po ay mapanganib at nakakamatay kung hindi agad matutuklasan ng maaga at magagamot.
Yes, at nagsisimula ito sa mga cells ng mga breast tissue na bumubuo ng bukol at maaaring kumalat sa ibang bahagi ng katawan.
Alam niyo ba mga kada na maging ang mga kalakihan ay hindi ligtas sa posibilidad ng breast cancer?
Yes, kaya ngayong Breast Cancer Awareness Month, layunin natin magbigay ng tamang impormasyon at hikayatin ang lahat ng maaagang pagpapasuri tungkol dito. Paano ba natin maiiwasan ang breast cancer?
Kaya naman ngayong Lunes ay makakasama po natin ang ating bisita mula sa Philippine Cancer Society, ang Diplomate in Family Medicine, Palliative Care Physician na si Dr. Mary Justine Grageda-Valdecañas or Doc MJ.
Yes!
Good morning, Doc MJ.
Good morning po.
Ayun, Doc MJ, sabi mo nga I can call you MJ. So
Yes,
let's go
sure,
ahead
no
with
problem.
that. Go ahead and please greet our Kadas.
Hello, good morning to everyone. I'm Dr. MJ Valdecañas and I'm from the Philippine Cancer Society.
Doc, ano nga ba ang status ng breast cancer sa ating bansa ngayon?
Well, based on statistics, actually po, it's increasing. Tumataas ang cases. But I think it's because of our efforts to advocate early screening. And I think that's the reason why we have more cases or we identify more cases. It's because more people know or more people are aware that they should be doing their self-breast exams. Marami na rin pong taong mas nagpapa-check up ngayon, hindi po gaya dati.
Actually, totoo yan. When you have, actually, even in advocacy, when you promote something to be, di ba, advocate in this way, sometimes mas dumarami pa nga yung numbers because there's awareness na ongoing.
Yes.
Pero what can we do kaya, Doc, para hindi yan matutuloy-tuloy? Just early screening lang ng mga tao.
Right now, breast cancer is one of the most survivable.
Yeah, I think so. Treatable, no?
Treatable. If we detect breast cancer early.
Ng maaga. So ano yung mga types of,
Yes.
well, I will ask all the questions mga kada. Alam na naman na I'm a very vocal about this, that I'm a breast cancer survivor for 6 years now, Doc. So, tatanungin ko lang lahat ng mga tanong na ito para sa kaalaman po ng mga kada natin. Ano nga ba, Doc MJ, ang mga types of breast cancer and stages?
So, with types of breast cancer and stages, it differs lang talaga kung saan nanggagaling or nag-originate yung breast cancer cells. So, with our breasts, you have the lobules and you have the ducts. Pwede po siyang manggaling sa ducts. Doon lang po nagde-differ kung saan siya nanggagaling and how it spreads. So, baka medyo matagal ang lecture if I do explain all of them. But we also differentiate the stages based sa kalat.
Based sa kalat.
Based po sa kalat.
Sample, yung sa akin 2B.
2B, okay. So usually po, breast cancer starts, localized lang siya, nandun lang siya sa breast. But because may lymph nodes po tayo,
Yun,
pwedeng
naman yan sa akin.
pwedeng mag-travel yung cancer cells, it can travel to other parts of the body. So dun po nagmamatter yung stages. The higher the stage, mas madami pong kalat.
Yung sa ano po ba, Doc? Kasi nakaka-curious din talaga. Paano ba talaga yung mga early detection sa breast cancers? Kasi even may mga bata po ba nakaka-experience na ng ganun mga early stages?
Yes. Especially kung meron po tayong first degree relative na merong breast cancer. For example, nanay, sister, na meron pong breast cancer, you are at higher risk. So we advocate this Breast Cancer Awareness Month. We do advocate the self-breast exam. So the self-breast exam, libre. Mura.
Libre siya, Doc.
Siyempre, ikaw gagawa, no?
Akala ko yung ano sa hospital, libre na siya. Doc naman. Yung self-exam lang.
Later, I will get to that. But we advocate the self-breast exam. You can do the self-breast exam once a month, 1 week after the last day of your menses, for those who are premenopausal. So, hindi pa po nagme-menopause.
Ako, Doc, ginagawa ko every time that I shower, maybe once a week.
Yes.
Sine-check ko talaga because nga nangyari na sa akin. So, it became something na talagang regular basis. And I think that's even better than just like thinking about when was your last period.
Yes,
menstruation,
that's
diba?
true.
Diba?
Since libre naman siya, you can actually just do it as
Anytime.
often and as frequent as you want. Tama po kayo, Miss Diana. You can do it while you're in the shower or you can do it while you're in front of the mirror. Kasi you have to be able to observe yung breast mo. So, what do we have to watch out for kapag nagsa-self-breast exam? So, what we usually do, I'm not sure if this is what you also do, we teach everyone, our patients, to do the self-breast exam. What you do is, for example, your right hand, you put it at the back of your head, lalagay nyo po ito sa likod ng ulo. Your other hand should be palpating your other breast.
Yeah.
So, kung nasaan. So, this is to push out your breast muscles. And then, kakapain nyo po siya in a circular motion until you reach the nipple area. And then, you also check for nipple discharge. So, pag may makapa po kayong bukol, makita nyo po na merong skin dimpling or meron pong mga parang uka sa breast ninyo. O kaya medyo malaki po yung pores, parang orange peel. It's what we call peau d'orange. Pwede po kayo magpa-check up sa mga doktor ninyo. And getting to that, DOH already has the what you call this, consulta packages. Yes po, if you go to the government hospitals, kasama po ang free breast exam by your
naman
doctor.
pala, mga kada. Ayan, Dr.
Yes.
Jay.
At may follow-up question lang ako, Doc. Kasi na-mention niyo po yung bukol. Kasi paano po ba namin masasabi na kailangan na namin magpa-check up? Anong klaseng bukol po talaga siya, Doc? Like malaki ba o maliit?
It does vary. Minsan po may makakapa kayong bukol. It can be malignant, pwede po siyang cancerous, pwede din siyang benign.
Pwede siya benign or cyst, no?
Yes, it can be a cyst, pwede po siyang benign. So, any kind of mass na makapa nyo po, usually sinasabi ko sa patients, parang holen yung makakapa ninyo. Or anything na hindi siya breast tissue, hindi siya malambot like your normal breast tissue. Just go to the doctor to have it checked. And that's where also our screening interventions come in. So we recommend mammography every 2 years for premenopausal women. The mammography can be done at your local hospitals. DOH already provides free mammography screening sa mga government hospitals.
Doc, question. Nung una ko nalaman yon, nangyari sa akin, was through ultrasound first.
Yes.
So, workable din po yun, if
Yes.
ever. And then, Doc, nabanggit namin kanina, nangyayari din po ito sa lalaki, pero hindi masyado pinag-usapan. Can we talk about it?
Yes. Breast cancer in male is actually already happening.
Common, correct.
Not really common.
I mean,
but
it
it happens in
happens.
about
Oo.
1%
Yeah.
of cases of breast
1%
cancer.
lang ba?
Yes, about 1%.
Sa Philippines. So,
But this is actually a worldwide statistics for breast cancer in the Philippines sa men. Medyo underdiagnosed pa natin.
Opo.
And this is why we do this. This is why we want to promote breast cancer awareness. So ang lalaki at babae, pareho pong may breast tissue. Siyempre, hindi lang siyempre, iba yung itsura.
Opo.
But both can have abnormal masses. So pwede rin pong magkaroon ng bukol.
Yes.
So we have to actually encourage the men because sometimes there's a little stigma.
Yes.
Na feeling nila hindi yan
Exactly.
tumayayari, ganyan. Probably po yung mga asawa ninyo or yung mga tatay ninyo po, pakisabi po sa kanila na please check or
Yes.
mag-self-exam, turuan nyo po sila. Kasi kayo
Yes.
yung mga babae, masanay dito.
Yes.
At saan ba makakuha po ng, what's the cause of breast cancer?
Well, cancer in general, wala pa talaga po tayong definitive na mga risk factors. But what are known and what are modifiable is of course number 1, obesity. Studies have shown na mas mataas ang weight, mas overweight, mas obese ang mga pasyente, higher risk to develop cancers. So that's why we always advocate for a healthy lifestyle. Regular aerobic exercise, usually 150 minutes a week. That's the recommendation of the American Heart Association. As well as, syempre, to avoid the known risk factors or yung carcinogens. So, ano po ba yung mga alam natin na nakakakos ng cancer? Number 1, smoking. Smoking, not only ikaw ang maninigarilyo, but malalanghap mo or mai-inhale mo yung usok galing dun sa mga family members. And that's why secondhand smoking is also a risk factor that we look at now. Kasi kahit hindi ka naninigarilyo, pero yung asawa mo naninigarilyo, you've inhaled
If you inhale,
everything, we
correct.
see patients who develop cancer because of that.
Okay. What about the role of diet pagdating sa breast cancer? Is there something there?
Well, as I mentioned, we just see obesity as one of the reasons
Sure.
or risk factors for having breast cancer.
So would you recommend any food though?
Of course, we recommend the DASH diet. It's what we call the DASH diet. a diet rich in fruits and vegetables. Technically po, kakain lang kayo, mas madami po tayong gulay at prutas kesa po sa mga processed foods, french fries. Bawasan po yung fried foods, yun po yung mga kailangan nating gawin.
For me, ang
Nakakatulong din
culprit
talaga
dyan yung
siya.
processed foods, no?
Yes.
Naku, ako mahilig pa naman
Mahilig
ako
ka ba dyan?
minsan.
Mga delata?
Mga cravings.
Siguro once a week mo na lang yun.
Tsaka instant noodles.
Ay, naku.
The state of
talaga?
the
Instant
Philippines,
noodles.
yes. Madami
Uso-uso
mahilig
pa
sa
naman
instant
dahil
noodles.
sa mga K-drama, mga cravings.
Yes.
So careful lang,
Dahan-dahan
mga
po tayo
kada.
dyan sa mga binge eating. Pero ito, can we debunk dito yung mga misconception na fake or fact tungkol sa mga breast cancer?
Sure.
Like breast injuries can cause breast cancer.
Of course, it's not true. Yung mga sinasabi na tamaan ng anak ko yung breast ko when
Oo, may mga
breastfeeding,
ganyan eh.
that happens. Hindi naman po risk factor. We haven't seen any link to trauma and to having breast cancer in any patients at all. So it's
Ano
not
yan,
true.
Doc, MJ? Kapag naisip mo yan, yung mga boxer pa, no? Diba? Lagi sila
diba?
hit everywhere.
Yes.
But anyway,
Saan?
joking aside, here we go. Breast cancer is more common in women with bigger breasts. Totoo ba?
Okay, so in a way, it can be true. According to the National Breast Cancer Foundation, it can be true because yung mas dense or mas
More tissues?
malaking breast, mas maraming areas kung saan panggagalingan yung malignant cells. However, hindi po yun automatic. Hindi ibig sabihin mas malaki ang breast, higher chance talaga. But if you think about it, there can be a reason
Yes.
why that happens.
Ikaw naman, V.
Ito, Doc, gusto ko malaman talaga kasi ging vocal na din ako about it. Kasi sa family din na may history na prone to breast cancer. Then ano po ba yung mga ways na as early sa age ko, maiiwasan na po yung mga ganon? Yung sa breast cancer na
Pagdating sa
detection.
genetic.
Na magkaroon. Well, for one, sa genes, wala talaga tayong nagagawa doon. But early detection is the key. That's why we advocate for Breast Cancer Awareness Month is to do your self-breast exam once a month and to undergo the screening procedures. Since 40 years old pa, nire-recommend ang mammography. For younger patients, we recommend the breast ultrasound. So you can actually have that done and discuss it with your physician.
Okay.
Ito, Doc. Let's continue the fake or fact. Brass with underwire can cause breast cancer.
Yes.
Totoo ba yan?
I think there was a trend a few years back. Kaya nauso ang wireless bra, di ba?
Mga seamless.
Yes, but actually it's not true. We haven't seen any links
Wala
to
naman.
that na definitive ha. So, as far as we know for now, it's not
Wala
true.
naman.
Yes.
Okay. So, go lang kayo dyan. Okay? Breast cancer is contagious. Sabi.
ba?
Of course not.
Ayan.
Breast cancer develops because of the risk factors, your exposure to smoking, your genes. Hindi po siya infectious at hindi siya nakakahawa.
So more on sa lifestyle na din talaga.
Lifestyle mo, no? Ano po yung mga treatments, Doc MJ, pagdating sa breast cancer ngayon? Let's update everyone.
If I may ask, ano po yung mga
I had
Miss Diana?
surgery, I had combined 3 treatments. So, I did a 1-year treatment. I had hyperthermia. I had ozone. I have a list. I have an ozone therapy. I even have the cocktail of what they used to inject me with. After surgery, I removed a lot of
The
tissues
tissue.
on my right breast. And then they had to do reconstruction so that I can still work the way I
Yes.
used to work prior to breast cancer. And I changed my diet completely. So, pero let's not talk about my diet because people are so tired of it now. Can you talk to us about the role of chemotherapy and radiation pagdating sa breast cancer?
Yes, so that's true as what you have undergone. With breast cancer, the earliest forms, yung mga localized, nandun lang siya sa breast. Ang best treatment pa rin is surgery. May abnormal cells, tanggalin yung abnormal cells. Yun po ang pinakamagandang way to remove it. But sometimes, we see na merong mga kalat na sa lymph nodes. With a self-breast exam pala, you also palpate your axillary areas. So, sa may kilikili, ipapalpate nyo po siya. Kapag meron tayong mga bukol din doon, it can be a sign na baka meron tayong bukol sa breast. So, So, if those happen, nagko-combine po ng chemotherapy, radiation therapy, and the newest therapies are your biologics, or what we call biologics. Tinitignan natin kung responsive sa estrogen, progesterone, these are receptors in your body. If responsive sila, there are pills that patients can
Ang
take.
galing.
Yes.
Oo, yung sa akin triple positive. So probably
That's good, yes.
responsive.
Very
Oo.
responsive pag triple positive.
So, Doc, kasi may mga cancer din, bukod sa breast cancer, na talagang only chemotherapy can cure it. Pero pagdating sa ganyan, like yung sa akin, meron sila natanggal din na lymph nodes, which means papunta na doon. Kaya ang
Yes.
early detection po is very, very important. Go ahead, V.
Yes.
Ano pa mas, ano natin? Ano po yung...
Napapaisip kasi talaga ako.
Dami mong questions
kasi
about
especially
this. I
now,
like
di ba,
it.
meron na talaga even late stages na nila nalalaman. Kasi tayo girls, hindi natin masyado namamalayan na. Feel natin normal lang. So, mas importante na recommend mo talaga, Doc, na mag-self-examination
oo.
and magpa-early check-up na, especially sa may mga history sa family na gano'n.
Oo.
Yes.
At ngayon, since Breast Cancer Awareness Month, may mga activities po ba na inihanda ni DOH sa atin?
Yes. So for DOH and the Philippine Cancer
Cancer
Society,
Society also.
yes. We have numerous activities. Number
Nice.
one,
Tell us.
we do have the mobile breast ultrasound and cervical cancer screening vans. So these vans go around the Philippines, and we have breast ultrasounds that are portable. So we can advise patients. We do breast exams by the physicians there. We also do the breast ultrasound para makita po. As well as we also have advocacy lectures. So for this year, we partnered with Avon for a campus roadshow, and we did the Avon Pink Parade. So the Pink Parade was a walk somewhere in Emerald Avenue to promote breast cancer awareness.
Yung mobile po, saan nating mahanap, or do we have to hire it privately, or we have to go for whenever it's parked somewhere ba?
So, ang advice is for the Philippine Cancer Society, you can contact our office.
okay.
You may approach your local barangay health centers, and then they can coordinate with us so we can schedule these activities in your area.
Cool, Doc MJ, that's good news. And ngayon, bigyan mo kami ng impormasyon kung saan po ka namin pwedeng hanapin. I'm sure
Yes,
maraming
please,
babaeng gustong kakausapin.
Or
Kasi
ma-follow
this is
na
so
din.
important.
Yes.
Yeah.
We do have our social media page, Philippine Cancer Society, both in Facebook and in Instagram. And I think those are flashed in your screens right now.
Yes.
Ayan.
And Doc, last mensahe lang po
Yes.
para sa lahat ng mga nanonood sa atin ngayon.
Yes,
Kasi yung
for
iba,
this month.
walang awareness, walang care. And minsan, pag nalaman na nila stage 3 or 4 na, mahirap na po. So, mensahe po para sa kanila, please.
So for breast cancer, the best way to beat breast cancer is early detection and screening. So maaga po nating makikita ang bukol, mas maaga matatanggal, mape-prevent or mapipigilan po natin ang pagkalat. So kapag may tanong kayo, just do the self-breast exam.
Yes.
Once a month, kayo po ang gagawa sa bahay, libre. So nothing should deter you from
Yeah.
doing that at home. But also we recommend, once a year, you have your breast checked
Yeah.
by a
Yes.
physician. Punta lang po kayo sa local health centers, punta kayo sa government hospitals near you if you have these questions or may makapa kayong bukol para mas maaga po nating matanggal or malabanan ang breast cancer.
Ayan. Thank you so much,
Thank you
Doc
so
MJ.
much.
And to thank you for passing by
Ayan.
here sa ating show and giving us this news. We have a gift from front
Thank you
row.
so much.
At Doc, importante talaga po yung sinabi niyo po na dapat talaga mag-exercise din.
Yes.
Oo, and wag nating pabayaan din yung katawan natin. Katulad ng sabi mo, sometimes pag obese tayo or pag medyo overweight, mas prone po tayo sa sakit. Kahit anong sakit, hindi lang breast cancer
Yes.
po. Pero talagang let's stay healthy mga kada. No? Via, now you know.
Tapos, especially now, gagaya talaga dapat si Ate Diana. Active yan sa gym, mga kada, kita-kita natin
Complete
ang lahat.
lifestyle change nung time na yan.
Yes,
Kaya
good.
importante po talaga alagaan po ating kalusugan.
Oh, and if I may add, for all your viewers, palagi po itong tanong ng mga patients, ng mga
Yes.
nanay, for those who do household chores, minsan sasabihin nila, I already do my exercise.
Oh.
Nag-household chores ako, pagod ako sa paglilinis, paglalaba. Hindi po siya exercise. Proper exercise, of course, is dapat po medyo bumibilis ang puso. Brisk walking or jogging, at least kahit 30 minutes lang po. Yung mga mommy natin nagzuzumba, kahit 30 minutes a day lang po. Yun ang tamang exercise.
Ayan. Thank you so much, Dr. Jane.
Thank you so much for having me.
You will be saving a lot of lives today.
Hopefully.
Just good news. Hello, mga Kanet 25. This is Diana Menezes, and for more Kada Umaga updates, just click the subscribe button and follow us on Net25 social media pages at Net25 TV and at Net25